everyone. For my demonstration speech, I chose to do a speech about DIY at home basic first aid and EMT skills. With me I have an assistant, Rob, who's going to help me out, so if you come over here. My goal for doing this is to incorporate at-home materials that you can use instead of the special things like backboard splints and cravats that are actually for injuries that you're not always going to have with you. The first thing I want to talk about is splinting. So if you're with a child, you're babysitting, and they fall off the monkey bars or anything like that, we're going to pretend that our patient has a break right here in his mid-forearm. So what I have here is an at-home hanger. Anything that is kind of stable, long like this, that can go over the arm. Can you hold this? Is really what you want to stabilize this injury so he doesn't move it any more than they already have. Obviously, someone else will be holding his arm for me, as well as the hanger. What you want to do is tie above the suspected break as well as below the suspected break. Again, I'm using ACE bandages, but you can use anything. You could use leggings, something as long as it ties this on here secure. So this is right now stabilizing his arm. Until police, fire, EMS get here, what I'm going to do is hold his arm for him, take all the weight off it and make sure it doesn't move, and hold it above his heart so that the blood is not going to be able to flow out this arm as easily until police get there, in case there's any bleeding. So that's what you do for a fracture. Again, this could also be done for the wrist, really anything that you suspect to be broken. The next thing I want to talk about is bleeding. So bleeding can happen a lot if you have a car accident. So if you come up on a car accident and there was glass thrown around in the car or anything like that, if you're at home and a child picks up something sharp and cuts themselves. Most bleeds, obviously, as we know, are minor. So if you have a minor bleed, take material, napkin, towel, put it over the injury and put direct pressure on it. If it's a more major, more severe bleed, this isn't helping. What you want to do is take another piece of material, paper towel, whatever, and put it on top of this first. You never want to take off anything, because when you take it off, it removes the clots that have already formed, making it bleed more severely. So if I'm holding this now and I see more blood coming out of this and I see it's really bad, what I'm going to do is either have my patient hold direct pressure on this, or I'm going to have someone that's with me hold direct pressure. What I have here is a belt. If you're in a crowd of people, someone is most likely going to have a belt, really anything. You could use a pair of leggings. You could also use an ACE bandage for this. What you really want to do is tie it really, really tight, or put this belt on really, really tight around his arm. Our goal is to cut off the circulation from this point down to prevent the blood from continuing to be lost from our patient. When you do this, always make sure it's above the injury. Never put it on a joint, so never put it on a wrist, never put it on your elbow, anything like that. When you do put this tourniquet on, never take it off by yourself. Wait for EMS to get there, and they'll most likely just have the nurses at the emergency room take it off. So one of the other things I wanted to talk about is EpiPens. Allergies are very common. Almost everyone has allergies these days and has an EpiPen with them. With young children, most of them do know how to use it, but it is helpful for an adult nearby to know how to use it. So this here is going to be our pretend EpiPen. It is a pen. In an EpiPen, you have one side that has the needle coming out of it and one side that you're supposed to have be on the outside of the body. You put your leg out. So when we put an EpiPen in someone, we never want to hold the EpiPen with our thumb on top of one side. This is because there's too much human error, and someone could get the needle through their thumb, which is too much adrenaline in your thumb and can lead to the death of your thumb, which is definitely not good. So when you do this, you just want to make a big fist around it, and you want to go towards the muscly part of your thigh. And what you want to do is you want to hit it really, really hard. So you're going to go 1, 2, 3 and hit it hard. And when you push down, there's going to be a click noise, and you want to hold it for at least 10 seconds. During this 10 seconds, the needle's going to be in his leg, and all the medicine will come out. At the end of the 10 seconds, we release it. The medicine is in his leg, and then you go to the hospital. So those are some DIY at-home skills you can use in an emergency if you have to. Thank you for helping me. Good patient. And I hope you learned something.